Pradeep Pendyala, Professor of Anesthesiology. Today I am going to talk something very, very interesting, that is talking about Post-Anesthesia Care Unit, PACU, and especially a discussion, short discussion about post-operative care. Friends, I'm sure you know a bit about it, but let me tell you few more points which might not be remembered by you. Well, I'm sure you will be knowing about Aldrich score, but today you may listen something more than just Aldrich. By the way, many people pronounce it as Aldrich scores. It is not Aldrich, it is Aldrich scores. It is related to when you should discharge a patient from PACU, from the hospital, the condition. Well, to that I'll come a bit later. But PACU, that is post-anesthesia care unit, is normally has some protocols. What are those protocols, my friends? I'm sure this may be or may not be new to you. Let me tell those protocols. What should be the protocols for maintaining or managing a PACU, that is post-anesthesia care unit? Friends, all patients who have received general anesthesia or regional anesthesia or even a monitored anesthesia care should be admitted into a post-anesthesia care unit without any doubt. A patient transported to the PACU should be accompanied by an anesthesiologist or a member of his team. That's very, very essential, who knows how to monitor and how to give certain medication in case there is a problem during the transportation. Well, this is few of the protocols. Now coming to on arrival of the PACU, post-anesthesia care unit, the patient shall be re-evaluated and a brief introduction of the patient and what are the instructions should be communicated to the concerned nurse of the post-anesthesia care unit by the anesthesiologist without any doubts. That has to be there. And the patient condition shall be evaluated on regular intervals, preferably every half an hour, 1 hour during his stay in the PACU by the concerned anesthesiologist. Friends, this is very essential. Well, when you talk about post-anesthesia care or post-operative care, you must know that it has to be done at PACU, and normally the emergence from the general anesthesia is a smooth and gradual awakening. And when he's awake, he's getting up, the things which has to be noticed by the anesthesiologist are airway patency, vital signs, oxygenations, level of consciousness. These are things has to be assessed. Well, blood pressure, heart rate, respiratory rate measurements are bound to be taken. And if awake, muscular functioning also can be checked by head lift for 5 seconds and seeing the grip of the hand. That tells so many words about the patient. So temperature monitoring is also equally essential, and that's very essential. And you should be able to communicate with the patient and see whether hydration is okay, is there any pain or not, or any nausea and vomiting. That's very frequent. The patient has nausea or vomiting. So you have to be very careful. Look for any shivering. Is there any hypothermia? Is there an agitation? And if at all there is pain by the patient, complaint by the patient, you have to take care of. Respiratory complications also has to be looked for, and if at all the person have any history of congestive heart failure or COPD, all the more important. So you have to be very, very careful with such patient. So it depends on the type of surgery, how long the patient had the surgery. That also depends on your post-operative care and management. So upper abdominal surgery like thoracic surgery, you have to be very careful. Such patient, airway obstruction can be due to tongue fall, laryngospasm, glottic edema, lot of secretion, blood in the airway, retained throat pack. Sometimes accidentally it may be left over. So these things you have to see. Look for any hypoxemia. If it is there, you have to give supplemental oxygenation or any hyperventilation. So if at all there is hyperventilation, the PaCO2 will be definitely more than 45 millimeter of mercury. That is very essential. And look for any evidence of hypotension. So these are the things you have to see. Look for cardiac monitor and look for any arrhythmias. If at all is there, you have to take care of it. That's very, very essential. Look any evidence of bradycardia, premature atrial or ventricular complexes, hypertension. Hypertension is another problem. Postoperative hypertension. It's very common in postoperative period. So look for that. And the most important thing, as I mentioned, I promised you in the beginning of the lecture, you have to see the recovery score, that is known as Aldrich score. Scoring is very interesting. What are the things to be seen in Aldrich score? I have to repeat every student. Most of the students say it is Aldrich. It is not Aldrich, it is Aldrich. So you have to see activity level, whether he moves or the patient moves all extremities voluntarily or on command. If he does it, the score is 2. If it moves only 2 extremities, the scoring is just 1. Cannot move any extremities, you have to give a score of 0. Similarly, you would have to look for respiration, whether the patient is breathing deeply and coughing adequately, you can give 2 score for that. Or if the patient is having shallow breaths or dyspneic, you have to give 1. And if at all is not breathing at all, apneic, you have to give 0. Similarly, you look for the blood pressure. Is it more than 20 millimeter mercury than his previous level of blood pressure? And the score is 2. If it is between 20 and 50 millimeter mercury, more than the pre-anesthetic level of his blood pressure, you have to give a score of 1. And if it is more than 50 millimeter mercury compared to his previous anesthetic level, you have to give 0 score. Similarly, look for his consciousness. Is he fully awake? If he is fully awake, give score of 2. Is he arousable on calling? Give 1. Is not responding at all? Give a score of 0. Oxygen saturation we have to determine by pulse oximetry. That's a must. Every PACU must have pulse oximetry. It's a must. And if the SpO2 is more than 90% when breathing room air, you have to give a score of 2. And if the patient requires supplemental oxygenation to maintain a level of 90% of SpO2, you have to give a score of 1. And if the SpO2 score is less than 90, even after giving oxygen, you have to give a score of 90. So what is the value of all this? The maximum score the patient can get is 10, and a score of more than 9 is definitely the patient is fit for discharge. Friends, post-anesthesia care unit is an area which provides post-anesthesia care, especially after surgery, and it should be preferably given to all the patients who had surgery or given anesthesia of any form, regional anesthesia or general anesthesia. All of them should be provided with PACU. So all the patients who receive anesthesia should be admitted in the PACU without any doubt. The aspects which has to be seen in PACU shall have policies, as I have just mentioned, There are a few protocols which has to be maintained by every hospital, everywhere. And the design and equipment and staffing of the PSU should be consulted by sole one person, that is an anesthesiologist. Have a wonderful time. Happy Sunday. This is Colonel Pradeep Pendiala signing off for tonight. Until next time, take care. Bye-bye.